All right, let's make another useless video according to somebody that commented. Anyways, welcome. 168 episode ADHD and online misinformation. The classic version of therapy. You thought you may feel therapeutic, express advice, proceeding with caution. The number to call and step into the role of mental health, the influencer, opens the door to fame and financial incentives, especially in the US. All attachment styles, or at least try them out, or who else might be the disorder they draw, are reaching millions of people through social media. If you're difficult to assess out, so-called experts are credible and whether the information is trustworthy or not. This often leads to misinformation and misdiagnosis, obviously, because the scientific-based evidence is not provided online, either with a therapist or with a chatbot or even with a fake therapist, right? Fraud happens all the time. This often obviously leads to misdiagnosis and extremely harmful misunderstandings in the future that negatively affect the mental health or health in general of the patients. The way information is so rapidly spread on social media can make it difficult to figure out what is accurate, what is professional, and what is expertise and evidence-driven information. On the mental health professional side who are active, they should demonstrate three qualities: competence, good faith, and integrity. Most credible mental health influencers will be transparent about training, licenses, and areas of expertise. The American Psychological Association, APA, that's where APA reference comes from, and that is how I frame mine as well at the bottom. Guidelines for the optimal use in social media in professional psychological practice. That's actually a program, like a term. Encourage psychological professionals to update their personal and professional website routinely and to monitor their information. Monitor the information others have posted them online and verify its accuracy and correct it if necessary. Most of the practitioners specify in their official bio what their expertises are, such as mental health, psychiatry, social worker, or anything else, addiction therapy, or any other professional role that does not require an actual ND license. If they are legitimate, they are going to appear on Psychological Today, possibly, most likely LinkedIn, and Association of State and Provincial Psychological Board in the U.S. In Canada, the legitimate healthcare professionals will be listed on the College of Physicians and Surgeons website, and you can look up their CPSL number as well. The APA Code of Ethics, I like that, stresses that psychologists must avoid conflict of interest. But these situations can still pop up online when healthcare professionals market products or services that has ill-intended motives. With today's technology, including using AI to generate false identities and fake credentials, as well as facial recognition, they post them on social media as legitimate healthcare professionals. So watch out for that. If you feel and think it's ill-intended and it's putting others in severe danger, report the practitioners to the license board or the college in the state where they practice. Again, in Canada, it is with the College of Physicians and Surgeons. So, a rule of thumb, never, ever, ever try to diagnose yourself or somebody else from social media and internet information you acquired. Social media are often fixated on labeling, and that is what I'm trying to fix with all my episodes. No labeling. Okay, fine, I label myself with ADHD. Woohoo! You do this. Okay, so, example, you do this 10-question test, and you will have your diagnosis right away. What's the diagnosis going to be? I don't know, borderline personality, ADHD, something. Or if you give 5 symptoms, you're depressed. Okay, sure, that really works out. So these types of labeling can run counter to the APA social media guidelines, which recommend psychologists avoid offering diagnosis, giving advices, or otherwise behaving as if they are conducting real treatments. Therapists are typically trained in a number of modalities such as CBT, EMDR, somatic therapy, art therapy, and so on and so on. They might specialize in and even prefer one expertise, but they should not be touting it online as end-all be-all solutions. So, what's the conclusion? Therapists on social media are just that. They are therapists. They are not your own therapist. So go to your local hospital, find a psychologist or psychiatrist, and start your CBT journey along with the medication. And good luck.